Sorry.
Okay, Finn, how are you? Hey, well, kia ora, good morning, everybody. I just wanted to say it's great to be here with Dr. Shane Reti. We're here today because it's been great to be at the Manukau Super Clinic and actually meeting with our frontline staff who are doing an incredible job at the infusion clinic here. Of course, they're doing their job. We're doing our job, which is making sure we get $604 million worth of 26 new cancer drugs and 28 new medicines out to patients as quickly as possible. And so it's been a good opportunity for us to see, given that investment in new drugs, actually what else do we need to do around the deployment to make sure that we can actually support people in a better way, quicker way, faster way, and get the benefit of those drugs flowing through to those 175,000 people. So it's been a really good morning, and just again struck by what outstanding staff and people we have in our healthcare system. That is also why this week we've appointed a commissioner into Health New Zealand to make sure that we can get even better performance and better delivery out of the organisation so that we can make progress on those big 5 health targets that we have. With that, Shane and I are happy to take your questions.
Prime Minister, regarding abuse in state care, what specifics can you give abuse survivors about the redress timeline in November?
Look, what we've said is there's 138 recommendations in this report. We met yesterday again with the redress support group. There's a dedicated group that we want to partner with and work our way through the options. And it is quite complex. They've proposed some good ideas and some innovative solutions. We're going to consider all of those, and Minister Stanford will work with that group to deliver our redress in due course.
Are you able to outline when they'll be consulted about compensation? I know that's going to be an important thing.
Well, that as I said to you, we are partnering with the redress support group. It's a particular group of the survivors that has been formed, and we will work up a solution with them and consult with them on that.
And they'll outline who's entitled to what?
We will do that together, yes.
Did you meet with survivors after the speeches in the House?
Absolutely.
What did they tell you?
I mean, they were just very grateful that they had actually been heard and believed, and for many of them, that was what they wanted to see. I mean, 2,400 very brave, courageous Kiwis told their stories and shone light on their truth, and for the first time, after all of the fight that they've had going on, what I wanted to do yesterday with the tabling of that report was actually to say, you are believed and you are heard. And for many of them, they were blown away by that experience. And so we've now got work to do. We've got 138 recommendations. It's a 3,000-page report over 16 volumes. And we've got 10 ministers working under the leadership of Minister Stanford to make sure that we can progress those recommendations and also continue to work with the survivors.
So with the comments and the recommendations and the speeches, has that given you any pause to any of the policies that the Coalition are putting forward now? Things like the boot camps, for example. How are you going to ensure that?
Well, I want to be very clear about that, because what we're proposing is something very, very different. Having read the full accounts, I've read all the 81 accounts of the individuals, and I've read the 5 case studies of the centres as well. And what we're doing is something very, very different. That was about unvetted staff. We have, in this case, senior psychologists and 2 social workers working with 10 young people consistently. That was about being isolated. We actually have a 3-month program, 9 months at home. We involve the whānau, we involve the family, we involve other community organisations. That was a program where there was no oversight and no monitoring, and we have massive amounts of protection and monitoring and safeguarding going on. So we're doing a powerful targeted intervention in the life of serious young offenders, because we do not want them going down a pathway into bigger crime and into gang life in particular. And so making a powerful targeted intervention in the way we are with the academies is actually, I think, a very positive thing.
Will you support police reopening investigations and prosecuting non-offenders in these cases?
Yes, we will. And again, there's quite a lot of complexity to that, in the sense of, if you are one of the survivors and you've told your story to the Royal Commission of Inquiry, those records are sealed because that's how they want them to be. But we're making it through the Survivor Experience Centre for them to be able to access those records and their submissions, and if it makes it easier and doesn't drive into re-traumatisation, for them to share that with police in those cases. But of course we encourage anyone and everyone to come forward with evidence that police can continue to do investigations around.
Will you implement convergent investigations on unmarked graves?
Look, we will work our way through a series of recommendations that are there. As you can imagine, we received the report just over 3 weeks ago. It's taken 6 years. As I said to you, it's 3,000 pages, 16 volumes. I've been travelling with copies for the last 3 weeks while I've been over in North America, and there's a lot of complexity to work through. It needs a really considered, appropriate response that deserves the dignity that survivors deserve. But I can tell you, we are geared up, and we want to make sure that we do the right thing here. We appreciate there'll be a range of views, even within the survivor groups and amongst the survivors themselves, as to what they do or don't want. It can often be very conflicting and very different, but we are determined to work our way through this.
You mentioned that you're consulting with survivors about the timeline of being compensated. We understand that a lot of the survivors, or some of the survivors, are in their 70s. Will we look at getting compensation by next year?
Sorry?
Will they?
Sorry, I missed you there.
Will they be looking at getting compensation by next year?
Well, we're very, very conscious that many of them are unwell and many of them are ageing, and we need to move through this as quickly as we possibly can. But I want it done right, and I want it done quickly and appropriately, and that's why we are working in concert with the survivor redress group or redress design group to make sure that we can get compensation and redress to them as quickly as we possibly can. Sorry, Nicole. Sure.
Dr. Reddy, the situation at Rotorua and Taupo hospitals with regards to emergency and ward shortages of doctors, what's your understanding of the situation in those hospitals?
So I visited Rotorua Hospital about 4 weeks ago, and I met with all of the senior staff. Very well run hospital, very, very efficient, very compassionate. And my understanding is that we have a shortage of emergency doctors, particularly SMOs, maybe some RMOs as well, in Taupo. And so there's looking to be a sharing of expertise from Rotorua to Taupo. Now, what I'd add as part of our reset, we're looking to regionalisation where we might be able to share resources of this type. So this is consistent with the model of care we're looking to move to, but I do understand that then becomes a challenge in both places, actually.
I understand there already has been sharing for a number of years actually between the two hospitals. I mean, are you aware of that? It seems to be an incredibly contentious issue among some in the media at the moment.
Oh, look, I think the regional integration teams, which were the teams that were managing the 4 regions before we firmed them up and placed deputy chief executives there, they were looking to share all sorts of resources, how we could share infrastructure, how we could share health workforce as well. We're going to embed that even further so that with the deputy chief executives, they're even more responsive to local needs like you're describing here today.
But it is a tricky one, isn't it? If both hospitals are short-staffed, how thinly can you spread your specialists?
Yes, there is a limited supply. There are also other alternatives. There are some information technology alternatives. For example, I understand that Thames Hospital had been using effectively ED specialists through telehealth type mechanisms. So there are other alternatives that in this moment of sort of need that we can bring to that as well. I'm not aware if that's being introduced at the moment, but there are other alternatives that can be used.
You might also be aware that doctors' unions are saying that you might be saying there's no job freeze, but there's a sinking mid, numbers are being reduced. What is your response in terms of frontline staff? Are there jobs being frozen or not?
My response is if we look back month on month, there have been hundreds of new appointments into Health New Zealand, and I've made it very clear in my letter of expectation to the new Commissioner that frontline staff are not to be adversely affected.
Prime Minister, just on the trains that were announced for Lower North Island yesterday, Simeon Brown...
You were a Thomas the Tank Engine fan, weren't you, growing up, Finn? I can see that. I can see that, yeah.
Simeon Brown announced 18 new trains for Lower North Island, but that was what Labour had budgeted for in 2023. Now, you've been critical in the past of Labour re-announcing announcements, so why are your ministers doing the same?
Well, we've been very clear that we've got 17 roads of national significance. We've got a couple of 4 big public transport projects. 3 are up here in Auckland. 1 is in the Lower North Island rail network. We've been campaigned on that. We've talked about that. That's what we announced today. So we want to see upgraded carriages, which will be great, and also some improvement to the rail network. And as you know, in the Lower North Island, there's good adoption of public transport, particularly rail. And it's important, given the ageing stock that's sitting there, that it's upgraded and invested in the way that it is.
Speaking of your campaign, in your campaign manifesto you promised 22 trains, so I'm wondering what happened to the other 4?
I'm not sure. You might need to talk to Simeon Brown about that, but I just say to you, we're determining to deliver a solution for the people of the Lower North Island so they get a good public transport option, so it doesn't age out and time out.
Prime Minister, the Royal Commission said Te Tiriti o Waikato needed to be embedded within the CAP system. Will your government listen to that and stop the repeal of Section 7AA?
No, we believe in the fundamental rights of it, that the priority needs to be the health of that child and the care and love for that child, and that is the preeminent thing, that is the biggest consideration first and foremost, and that's why 7AA has been removed under legislation.
Is the government serious about listening to survivors of abuse and care if it's progressing with boot camps and removing treaty obligations?
Well, again, I'll just be very clear about that because I think it's a very simplistic way of framing it. As I explained before, you cannot go read the account. Have you read the account of the Great Barrier Island boot camp? You haven't read it? Well, I'd encourage you to read it and actually understand what actually did happen there, because it's a completely different proposition from what we're talking about here, and I think it's quite disingenuous to try and link the two. Yeah.
I just want to jump back to health, if that's okay.
Yeah, sure.
One last question for me.
No.
Te Whaka Ora reported 200 million surplus in March, but you say they were aware they were running up big debt in February. Can you explain what's happening there?
So I was being briefed in March of a ongoing monthly overspend of between 100 to 130 million. In February, I was informed that, quote unquote, up to March, we were on target for the $583 million surplus, which had been projected. 1 month, 30 days later, that had all changed.
How do you think we are going to attract more doctors to come here? Taupo says nobody's applied, they have been getting one person
Yes.
for shortages. How do we get more doctors in a competitive international marketplace to come here?
Yeah, and this is a good environment to be having exactly this discussion, because Health New Zealand in the past month or so actually sent a recruitment team over to, I believe it was the European Oncology Conference, and had a number of letters of expression after that, and I believe maybe even to interview stage. So that makes sense. Let's go to like-minded health systems where it's easy to credential them into New Zealand and turn up at their conferences and say, look, we'd like you to consider, would you come and work in New Zealand? Would that be something that would be interesting to you? And we've had some success with that. So I think international recruitment, go fishing where the fish are, I think is part of what we need to do.
But it has been happening. That's not the first time, is it? Te Whaka Ora sees a lot of recruiters overseas.
Look, it does, although we were particularly interested, as we are here today, around our needs in cancer and oncology spaces. So it was the European Oncology Conference, as I understand it. So maybe more targeted to our need rather than broader, just any conference, I think is what's happened here.
Thanks very much.
Great. Thank you, guys. Very good.
The inquiry in its report revealed that it's undertaken a confidential investigation into the claimed pedophile ring of politicians and senior civil servants in the 1980s. What do you think of this, and do you think it's credible?
Again, you go back to the inquiry and read the report itself. It had some serious concerns about it, but it couldn't find any evidence to support those allegations, and so the report and the Royal Commission was unable to make a finding around that.
Do you think that requires further investigation?
Well, again, if that's the case, we encourage anyone to come forward with police, given the nature of that allegation. But again, I just encourage everybody read the full section on that part of the report, because as you can see, while there are we're taking it very seriously, a concern and an allegation like that, but at the end of the day, there was no evidence or finding that was made by the Royal Commission of Inquiry. But of course, we would want people to come forward and actually work with police to be able to advance any further investigation on that.
I have some questions out of Christchurch. Who is the Minister for Water Safety and Drowning Prevention in New Zealand?
That would be who would that be best directed to? Can I come back to you? If you want to tell us the specific nature of the questions, we can get the right person there for you.
And do you think that $4 million a year for drowning prevention is enough, given that 90 people drowned in this country last year?
Well, again, we're trying to encourage greater swim education across our schools at the moment as well. And with COVID, that was a major problem, because we actually lost the inability to teach our young kids to swim in particular. I know there's been a big concerted effort across the education system to get more of our kids learning to swim properly post-COVID. So long may that continue. All right, thanks so much.
Thank you.
Good.